Hi, good evening. Welcome to Congressman Scott Tipton's live telephone town hall meeting. The event is now live. If you would like to ask a question during the call, please press 0 on your keypad at any time, and you will be entered into the speaker's queue. Before we begin taking questions from constituents, we will allow a moment for Congressman Tipton and his guest, Jeff Kuhr, the Director of the Mesa County Public Health Department, an opportunity to provide updates on the federal and local level at what is being done to battle the COVID-19 outbreak while safely reopening our communities. With that, I now hand it over to Congressman Tipton.
Thank you, Matt, and good evening, everybody, and thank you for joining our telephone town hall meeting. We're now nearly halfway through the year, and I'd like to take time tonight to be able to hear from you as our nation continues to address the spread of COVID-19 and our communities can begin to safely open. I'd also like to update you on Congress's efforts to be able to provide resources to healthcare facilities and pass emergency resources to provide support so families and businesses can bounce back to the levels that we were at in the months leading up to this pandemic. In March, Congress passed what most of you are familiar with, the CARES Act. This legislation, while far from perfect, has played a critical role in providing rural healthcare centers with PPE, ventilators, and financial resources to be able to keep their doors open. It also created the successful Paycheck Protection Program for small businesses that have kept millions across the nation afloat and families paid. In Colorado, more than $2.2 billion has been allocated to the state, including more than $26 million to be able to assist the state in testing, purchasing supplies, boosting staff, and improving data management. Additionally, the Small Business Administration has already approved more than 98,000 loans through the PPP, and an additional 14,000 economic injury disaster loans. The SBA and smaller community banks across Colorado have worked tirelessly to be able to prevent more than 100,000 small businesses from shutting their doors permanently in what has been a crisis for many of our communities. With fast spread of COVID-19, Congress needed to be able to move quickly on relief for communities whose economic activity came to a grinding halt just a few months ago. This immediate, targeted, and temporary effort has already begun to show signs of promise, as just last Friday, the Bureau of Labor and Statistics released the May jobs report, which showed that the nation added around 2.5 million jobs. For the first time in 3 months, we saw the unemployment drop from 14.7% in April to around 13.3%, in a time when many economists had predicted that the unemployment level would rise close to 20%. Our country is reopening, and Americans are getting back to work. I've continued to support local efforts to be able to apply for variances, which offer varying levels as to what extent the counties can reopen their businesses and public areas based on the COVID patterns in individual communities. This can be a slow and arduous process, which undoubtedly is frustrating for many of our communities where COVID-19 has not been prevalent. All of the measures, however, have been put in place to be able to keep our neighbors and the most vulnerable safe. And we must also keep in mind that those precautions have worked to slow the spread of the virus and to be able to save lives. Across the 3rd District, hospitals have not been overrun. Main Street businesses have proven their resilience by reopening their doors and adapting where possible. And as the vast majority of our communities have avoided catastrophic consequences that would have resulted if we'd failed to act. Lastly, I'm continuing to pressure China's Communist Party to own up to their deception and acts that fueled the global pandemic. It is well known that China's government has an abhorrent human rights record. They have a history of intellectual property theft of American businesses and continue other deceptive, manipulative trade practices. The U.S. can better position itself for future pandemics by reducing its reliance on China for critical supplies and sending China a loud message that its reckless behavior is no longer tolerated. By lying and deceiving the World Health experts early on, China has again made a costly error, and they must be held accountable. I'd encourage you to be able to go to our website and read more about my efforts on that front. COVID-19 remains as big of a threat today as when it first became prevalent in our country. While we've kept the curve flattened, prevented countless infections, COVID-19 is not understood enough to let our guard down. We're doing everything possible to be able to get businesses back open and to be able to restore some semblance of normal life. But I cannot stress enough that we're not out of the woods yet. I appreciate all of you taking time to be able to listen to tonight's telephone town hall meeting and hope that you find this information informative and productive. But before we open it up for questions, I would like to hand it over to Jeff Kuhr, Director of the Mesa County Public Health Department, who has done tremendous work there. He'll dive into the COVID-19 efforts there, guidance to be able to keep our communities safe at the local level. And I'd like to thank Jeff for being here with us one more time this evening. You've been incredibly generous with your time to be able to help spread over the word about this important work from the local public health officials and what you're doing to be able to keep all of our communities safe. Jeff, thanks for being here.
Thank you, Congressman Tipton, and we in Mesa County certainly appreciate your support. So I'm just going to talk about a little bit of, where we are with cases, but then how we've built into trying to reopen our communities, because as you mentioned, reopening is of utmost importance to us right now. And, I've always said that the perfect balance for public health is good community health along with a good economy. So here's where we are in Mesa County. We've only had 65 cases so far this year, and 12 of those have been within the past 2 weeks. Our first case started on March 14th. The highest single day case count has been 5, so our curve has remained flat the entire time. And we have been able to test over 3,000 people through our drive-up facility at the Mesa County Fairgrounds. So in order to keep our case counts low, we feel it's a result of great community partnerships. Certainly all of our hospitals, and our hospitals serve the entire region. We have put a special emphasis on preventing COVID-19 in nursing homes, in homeless shelters, and in detention facilities. We know those are sources for outbreaks that can be devastating, and so we put special emphasis on those types of facilities. And our contact tracing has occurred with every single illness. So I remember our very first case, we called 50 individuals as a result of that case. So over half of our positives were found through contact tracing. So if we were to do no contact tracing at all, I believe that our case count would be 3 to 4 times what it is right now. We have 4 epidemiologists on staff and 35 people trained to do contact tracing. So we can do 800 contact traces in a 24-hour period. And we can train more as needed. It doesn't take that long. We were the first county to request a variance under Safer at Home. We implemented that variance on April 13th, and that allowed us to open 30% capacity of restaurants and gyms, and then churches were still just allowed to have no more than 50 people. So then just recently, we were the first county to request a second variance, and that was implemented on May 23rd. That allows us to open up to 50% or 175 people, whichever's less, for most everything except large events. So that was really the first time we got to open up most all businesses in our communities. And then our gathering number went up to 50 from 10. So that was great as well. We are in the process of writing for a third request for variance. I had a meeting with the Montrose folks, city and county, yesterday, and the idea came up that maybe we should try to do this regionally, which I think is an excellent idea. So we are going to do that. It's going to be a variance request that would be Mesa County, Montrose County, and Delta County. We're asking to open everything. So we're not going to put any percentage limits, but with social distancing guidelines implemented. So naturally, we're not going to be able to fill places up to full capacity, but we're going to focus more on social distancing than we are on those percentages. Regional makes great sense because of the mixed messages across counties. All of these variances are county by county across the state of Colorado. If we can start to do this regionally, it makes great sense. And to do this on behalf of the Western Slope, we're excited to see what the results are. In our 3-county area, our television media is one of the primary sources. And so you can see how confusing that message gets for people in each of those 3 counties. And then also, along with that, our thresholds for success, which people always wonder about, at Mesa County only, we can't exceed over 150 cases in a 2-week period. We feel that's very manageable. And we can't exceed 50 COVID-related hospitalizations at one time, and those folks can be from anywhere in the region. By doing this, we think we should open up and responds to any diseases that come up rather than being left in a bubble with just being left to the unknown. So we would rather open slowly. We think this next step is a great progression, and let's just respond because we feel like we have the capacity to do so. So with that, I will wrap up and take any questions. Thank you again, Congressman.
Thank you, Jeff.
All right. Thank you for that update, Jeff. And for anyone just joining us tonight, that was Jeff Kuhr with the Director of Mesa County Public Health Department. As more constituents are getting online now, for the live telephone town hall with Congressman Tipton, I would like to remind all participants that should you have a question for the Congressman or Mr. Kuhr, please press 0 on your keypad and you will be entered into the speaker's queue. With that, I would now like to open it up for questions from the audience. Let's start with Ms. Harris from Grand Junction.
Hi, Ms. Harris.
Hi. So I appreciate you having this. It's very impressive, and I appreciate the work that's been done. My question is, I work at an essential business in Grand Junction, and in the beginning, the residents respected the social distancing and wearing masks, but in the past few weeks, it's less and less masks. And even though we're wearing masks at work and constantly cleaning, they're coming around the plexiglass barrier and speaking to us and getting angry or frustrated because maybe they can't hear as well. So I'm just wondering, because we just had someone at where I work test positive for COVID within the past week, is there going to be any kind of, control over people not respecting social distancing, or are we just going to rely on people deciding whether they want to or not?
Well,
thanks for that question. Oh, sorry about that. Go ahead, Congressman. Thank you for that. Go ahead. I'm sorry. I walked right over you.
Yeah, not a problem. Ms. Harris, I think obviously where we've been able to see that curve in terms of the infection rate going, good hygiene, good social distancing has certainly played a role in that. I know there are some people that have a great issue with wearing a mask. Businesses sometimes require it. If you're flying on an airplane now, most of them require that you do wear that mask. And I think just creating this awareness that this is what has stopped actually the spread of the disease and the infection that could impact any family is really important for us to be able to continue to try and focus on. And a lot of this will be handled at the county and the city levels in terms of how to best address it. But I do have a lot of faith in common sense of most people just to be able to be respectful of others and practice what I've seen, at least in the public venues that we've been in, practicing social distancing, good hygiene practices. And Jeff, do you want to add to that?
Yeah, and I appreciate that comment about, just everyone having some respect for others. It is a little confusing to people because I'll hear people say that they have a right to not wear a mask. And I certainly do not disagree with that at all. But the purpose of the mask is for the wearer not to infect other people. So I've told people, try to blow out a candle. If you've got a good mask on, you won't be able to blow out a candle. Now, if you can, you need a new mask. But really, it's not about the individual wearing the mask. It's about protecting those around you. And I have seen myself that mask use has dropped way down. But I will say every business has the option to implement a mask mandate if they so choose. So, maybe that's best for some businesses. We'll leave it up to them on a case-by-case basis.
We will now go to Pete in Montrose.
Hi, can you hear me?
I can, Pete. Go ahead.
Okay, fantastic. First off, I want to say thank you for holding this town hall. This is beautiful these time of day, especially with all the turmoil going on in this country. People don't feel that people listen anymore, and this is a wonderful way of showing that people do listen. Another thing I want to thank you for is I wrote you a letter about supporting USPS, and you wrote me back, and I appreciated the comment and the support for the United States Postal Service. I appreciate that very much. Thank you. So I have a twofold question. First, it's kind of dovetails into Ms. Harris's question. What are we going to do now that we see that a lot of states are opening up, not as carefully as Colorado? Colorado actually deserves a lot of accolades and kudos for opening up like it did. Governor Polis has done a great job. Everyone here has been very patient, and our numbers are quite low. In fact, we were very, very low on the Johns Hopkins list. We're doing very well, but when you see reports from Florida, Arizona, especially Texas, about re-spikes, and all of a sudden the COVID-19, the coronavirus coming back in a huge wave, what can we do? I mean, I know it's going to be hard, but I don't know how your sensibilities are about this, but what can we do to prevent that? And then number two, I know that you said there's a lot of loans going out to small businesses, and please don't see me as confrontative with this, but $5 trillion just went to some of the biggest banks, some of the biggest businesses that were not loans. These folks were given money, just like flat out given money. And I'm not blaming anybody on either side. It's what everyone felt they had to do, same as what happened in 2008. And then people turn around and want to give small businesses loans. Why can't you kind of reverse that a little bit and give these small businesses grants that will help them instead of loans? And then making somebody like, Goldman Sachs, give them a loan, let them pay back the loan, and give the small business person in this country, the people that really move and shake this country, grants instead of loans. Again, I'm not trying to be confrontative, but it's something that I've been curious about, because it's a small business person in this country that really does hire the people, really does move and shake the economy. Thank you.
You bet, and I appreciate your comments, Pete. The first, in terms of what other states are doing in terms of their reopening, we do have states' rights issues for them to be able to make their choices. We would encourage, I think, every state to do what we're seeing in a lot of our counties in the 3rd District, and that's terms of people being respectful of social distancing and good hygiene, to be able to make sure that we do keep our eye on the ball. This is still a very infectious disease that can impact others with travel. That is effectively how it first started, coming out of China over to the United States. And so creating that awareness is something that I think that we need. I think we've got some positive signs actually on the horizon. We've got a number of our pharmaceutical companies which are already in clinical trials in terms of vaccines, therapies to be able to treat. But ultimately that personal responsibility gets back to us in terms of doing what we can individually to be able to keep ourselves and our families, our communities safe. And it's even with the flu, when that breaks out every year in the United States. I think we'll probably see a drop in that as people have practiced better hygiene and social distancing from going on. But those will be some states' rights issues, and I think those governors, those state legislatures and communities will make hopefully some proper choices on that. In regards to the assistance to the small businesses, it's my understanding that the big businesses, the airlines as an example, these are loans that have to be repaid back. They're not going to actually be grants. I fully agree with you that the focus and the intent on PPP, the Payroll Protection Plan, was for our small businesses. They create 7 out of 10 jobs literally in this country. We go through our district, my history, I was a small business guy for the majority of my life. We create those jobs to be able to keep the economy moving, and that's where the assistance needed to be focused. As we saw in the CARE Act, and I noted in my opening statement that it was not perfect, but to be able to get legislation in a timely fashion through both chambers and a presidential signature, there were a few things in there that were inappropriate. We're now seeing some of those bigger businesses return those dollars, and Treasury is monitoring the dollars that have been sent out in a review process that's going to be in place. The loans that have been put out are fully forgivable for the small business if they maintain their employees. If they are incapable of doing that, it is at 1% loan, very low interest rate, to be able to pay that back. over the period of time. But the whole goal was to be able to keep everybody employed. If the business does that, the whole loan is actually forgivable because these businesses did not make a bad economic decision. They were forced to shut down.
We will now go to Jordan in Pueblo.
Hi, Jordan. Thanks for taking time.
Yeah, of course. Thank you so much for letting us speak and giving us this opportunity as the people to voice our concerns. So this next year, I'll be a senior, and I know that our youth are scared of our future education because of COVID. So I'm curious what precautions the public you'll be taking to protect people that are in public education, like students and teachers. What exactly you'll be implementing in order to protect those students and teachers on a government level, and how you think those precautions will affect our education, and if that will shift the effect of our performance as students.
Well, and I appreciate that, Jordan. Are you a senior this year?
No, I'll be a senior this next year.
Okay, and it's, I know, been an incredible challenge for our seniors graduating this year in terms of not being able to go through a traditional graduation. And as we look at reopening our schools, I think that we're going to see the entire mix to where there'll certainly be some homeschooling that'll be going on, maybe limitations in some classrooms in terms of size, maybe adjusting some of the schedules to be able to keep the students and the teachers safe from COVID-19. This is primarily going to be a state issue. The federal government provides some resources for education coming back to our local districts, but the determinations in terms of how that's going to be actually implemented will be at the local level. And Jeff, do you have some thoughts what you're thinking about from the public health department in terms of public schools on reopening?
Yeah, we've been talking about that. You know, the reality is that our community can't afford to open at a 50% rate. I know there's been talk about that, but it'll be very difficult because we need school so parents can work. I mean, certainly we need school to educate our children, but it plays many roles in the community. We have been talking about, what can we put out as a plan. I feel that we can open up with some precautions. I've seen schools in a single school district where 20% of the school has been affected by influenza, but then another school just down the road has had no more than 5% absences because they've implemented really good hand hygiene and social distancing measures. So I know it can be done. It's just a matter of us coming together and putting that plan in.
Okay. Thank you, Jordan, for being on, and good luck in your senior year.
We will now go to George in Pueblo.
Hi, George.
Hi, Scott. Hey, as you know, the state fair is normally held in Pueblo beginning in late August every year. However, that's in some jeopardy at this point due to the fact that that's a huge gathering, as you know, and the governor has extended the 10-person limit for gatherings through July. So there's a variance request in front of the Pueblo County Health Department and the county commissioners to try to make a decision on that as soon as possible, at least sometime the next week or so, because otherwise they're going to have to cancel the fair. I don't know if you have any impact on that decision, but that's a special case. It would be very hurtful for Pueblo if they couldn't have the state fair this year.
Those are some of the real worries that we have economically, George, and I'm glad you bring that up. State fairs very important for our state, and particularly for Pueblo. Draws in huge crowds across the state and drawing people from other states as well to be able to participate there. And this is something, again, this is going to be some determinations that are going to be made through the state and through the local levels. We have had regular conference calls with the governor, and we've been advocating, can point to Mesa County as an example, along with several others, to be able to advocate for those variances as we're seeing the communities demonstrate that they are willing and capable of actually opening up safely. And I think the state fair is something that we treasure literally for the entire state, and something that we'll keep an eye on, and hopefully by the time we do get to August, we'll be back to a far greater sense of normalcy in our state.
Thank you for that, Congressman. Jeff, did you have anything to add to that?
Yeah, I'll just say, because, a lot of us are all dealing with county fairs as well. I will just say that I don't think it's an all or nothing thing. I think there can be modified versions, and so people can be creative and sit down and figure out how to do these things safely, and I think it could be pulled off.
That we are going to head to Kelly and Pueblo.
Hi, Kelly.
It just said it's my turn to speak. I'm Audrey in Montrose. But
Well, Audrey, good to have you. So.
Great. My question is do you think that there will be any more either state or federal funding for small farms? So far, unfortunately, we have not been eligible for anything. The majority of our payroll last year was migrant workers, and for the EIDL, we didn't have any employees on January 1st as a small farm, and we grow hops, and hops are not an item on the commodity list for the CFAP, although we sell directly to breweries who have taken a huge impact, and therefore so have we, and we're struggling and hoping that there will, be hope left for some sort of help.
Yeah, and we've held several roundtables now with our agricultural community, Audrey, to be able to hear some of those concerns. Obviously a concern that there was going to be a protein shortage in the country as we saw the big meat packing plants that were shutting down. Co-sponsored the PRIME Act to be able to allow smaller meat packing plants to be able to sell in state. We've advocated with the USDA to be able to open up the doors for some of these plants to be able to sell across state lines. Still with the input, obviously, of the Colorado Department of Health, we want to make sure that the food products are going to be safe. There are some resources, and feel free if you would. We can follow up with you after this call. There are some dollars that are available in terms of some disaster relief due to COVID-19 through the USDA. Given the big scope of things, they aren't huge dollars given the scope of our agricultural community that is out. But one area that we have been working on to be able to get some assistance back is in terms of the box price of beef as opposed to the hoof price. So we now have an investigation that's going on through the Department of Justice and the USDA. Visited with Secretary Perdue on this very topic to be able to open the door because the sale of all of our agricultural products within the United States from our farm and ranch communities are critical for the economy and for the health of the people to have nutritious food on the table. So there are some assistance dollars that are out there. You do point out rightly that in terms of payroll assistance for migrant workers coming in, and that was by design, the dollars were to be for American citizens to be able to assist them and to be able to get those businesses back open.
Now we will try Kelly in Pueblo.
Hi, Scott. How are you?
Good, Kelly. How are you?
Good. I live in the Bessemer area, and there are a lot of street people that are unable to access masks. And if you walk around the area, it's business as usual, but there are a lot of businesses that are not allowing people in without those masks. Is there going to be anything done to help those people get those masks so they can go into those businesses, especially when, they're counting pennies and change to, do business with these places?
We've had actually several problems really when it comes to the PPEs, the personal protection equipment that you see. We've been relying on the majority of that to be produced in China and to be imported into the U.S. We've got some legislation to be able to repatriate that business back into this country to be able to actually make sure that we have that. This is one of the challenges that we saw as a result of the pandemic. We had not built up the backlog in terms of PPEs and also ventilators, obviously, not to mention pharmaceuticals as well. And, through the local county health departments, we have seen that production ramp up. The availability is increasing into our local communities. And this is something that through our Pueblo office, we can certainly check and see if the local county health department has an outreach program to be able to reach some of the homeless, to be able to get some of those PPEs, to be able to access some of the businesses and to be able to go in. But this is a challenge that's a little bit twofold. It's current access and also reclaiming back into the United States production capabilities so that we aren't having to be able to rely on a foreign government to be able to provide something that's going to be necessary in the event of another outbreak of COVID-19 or hopefully we won't ever see this, but another pandemic that could move through the country.
Thank you, Congressman. Jeff, would you care to elaborate just a bit on the status of PPE there on the West Slope?
Sure. It's a tough thing to get, especially what we're finding is gowns. And where that really comes into play is with nursing homes. If somebody leaves a nursing home for a procedure and comes back, then they're required to go into a 14-day quarantine, and then you're burning through PPE as staff go in and visit that person on quarantine. But to the point about the homeless population and the masks, it is a challenge, when a business requires masks. However, I agree with the congressman that you should contact Pueblo County Public Health because there are people that will come together to sew cloth face coverings, because I don't think anyone should be turned away without having something to offer to that person to be able to come into the business. And so that's sort of a community effort, I believe, and it's something anyone could organize. But certainly talk to Pueblo County Public Health, and I think they would help with that.
We will head to Mary Lou in Pueblo.
Yes, hello, Congressman Tipton. Thank you for the town hall. Can you hear me?
I can, Mary Lou. Thanks for being on.
My question dovetails with the previous one, only I'm concerned on a federal level, not just for the state of Colorado, and as a representative in the U.S. Congress, that is the federal venue. Many states, and I have relatives in several states across the country, the availability of personal protective equipment has not been able to meet the demand, and part of it is also a funding stream. And as we look at a flu season coming at us, the possibility of continuing rise in COVID-19 cases, is the federal budget going to be able to help purchase PPEs as that increased demands?
And I appreciate that question. Yes, dollars are being allocated to be able to meet that demand. And I also think that looking forward, we need to make sure that we're able to produce those in this country. That's probably our greatest weakness right now, is that we're relying on foreign governments, foreign countries, to be able to produce something that is critical to the health of American citizens. It extends beyond the PPEs, as I noted a little bit earlier, to pharmaceuticals as well that are coming in. The majority of those are manufactured in China. We need to be able to reclaim those industries back in this country to be able to provide that certainty for the health of our communities. But there are, in my estimation, this will continue to be validated as it's reviewed, that we're going to have the resources available to make sure that the PPEs are going to be available and the productions are ramping up literally across the country as more businesses are now starting to be able to enter that market. Many of the masks that we are seeing produced are not going to be the N95 mask, which is for the medical community, but they will provide some protection in terms of social situations from the spread of the disease. And we will continue, I believe, to be able to see that expand. But I think this has been a great wake-up call for our country to be able to note that we need to have that manufacturing here to be able to produce it rather than relying on China to be able to supply it for us.
We will head to Alyssa in Carbondale.
Hello, Mr. Tipton. I met you last summer. I am a high school science teacher in Carbondale. Nice to speak with you again.
Thanks for being on, Alyssa.
Hi, I'm calling just to inquire about any sort of legislative packages that you were supporting to invest in the school infrastructure, especially broadband, with regards to supporting learning that has been impacted so negatively by the COVID-19, especially in the rural areas.
Yeah, and I really appreciate you bringing that up, Alyssa. This is something we've been advocating for in previous Congress as well as this one. The broadband expansion, to be able to get that out into our rural communities, I believe is absolutely essential. From a health standpoint, to be able to have doctors to be able to do telemedicine. From an educational standpoint, as we may have some students that are going to be doing telelearning, literally from home, to our businesses, to be able to grow and to be able to prosper as we move out of this COVID-19 crisis, to be able to give people the opportunity to be able to live anywhere they want and have that access to the broadband. There have been a number of initiatives, as you're probably going to recall as I do, to where dollars were allocated to EagleNet to be able to build out broadband into underserved rural areas. We have asked for an accounting of those dollars, and we're still waiting to be able to get a response on how those dollars were spent, because we still have underserved communities. We have CAF2 now through CenturyLink to be able to build that out, again, to the rural communities. This is something that once was a luxury and has now become a necessity for the medical community, the educational community, the business community, and for families to be able to have that access to broadband. We've supported legislation to be able to expedite the processing, the permitting process, to be able to get the fiber actually into the ground, to get these out into our communities, and continuing to work collaboratively with other members of Congress that live in rural areas as we do, to make sure that they're going to be able to get the broadband that's going to be necessary. And by the way, one thing that might want to point out also, under the CARES Act in legislation that we did pass, we had almost $14 billion that's going to be going for higher education institutions to be able to support some of the costs for cost shifting. We've got a number of great universities that are in our district, Fort Lewis College down in Durango, Mesa State University, Adams State University, in Gunnison, and so also have Pueblo Community College as well. All important for the education of our kids, and there are some resources that were included there in the CARES Act.
We will now take a question from Sydney in Grand Junction.
Hello, Scott Tipton and the Mesa County the Colorado Health Department. I don't know which one it is, but I have a question about the about all dining sites can't open until the state and Mesa County gives the okay to open, and a lot of it has to do with social distancing because those dining sites are really small. And this is the and I volunteer for Meals on Wheels in Grand Junction. So I was just wondering when the dining sites will be able to reopen.
Okay. Jeff, would you maybe like to take that question for Mesa County?
Sure. You mean the dining sites like at the senior centers?
Yeah, and where I live.
They can open now, and whoever's responsible, or if you've got someone that you can talk to about trying to initiate that process, you can have them call Mesa County Public Health, and actually I'll give you a number if you've got a pen. The number is 970-683-2300, and because we can open those facilities now, so sometimes it's just a disconnect between people having the correct information and knowing where to access that process. So be glad to help you.
That. Can you repeat that number one more time?
Yep, it's 970-683.
683.
Yep, 2300.
683 2300. 2300.
That's correct.
2300. Okay. Okay, because
and thank you for that.
All right, because I wasn't sure because they said they had to get the okay from the hospital, the state, and then Mesa County and all that stuff.
Yeah, we can just do it straight through Mesa County. So.
All right. Thank you.
We now turn it over to Raylene in Grand Junction.
It's me.
Hi,
Hello,
Raylene.
Scott Tipton. Hi, how are you doing, honey?
I am well. How are you?
Well, just trying to survive. I do have a few questions because I am in the food industry. But the other question I do have is, why is our president not doing what you're doing? You're trying to keep us safe in Colorado, and he's not trying to do that.
Well, I think the president, the deployment of resources, had advocated for the CARES Act to be able to get those out for not only the medical community and the dollars. They've created actually great flexibility. Just to be able to give you an example, we had several hospitals, one up in Moffat County, that was not going to be able to receive any assistance. To talk to the hospital down in Montrose, they converted all of their day surgery centers over into IC units effectively, and they cut off their entire revenue stream because elective surgery was not going to be allowed. We were able, through the flexibility that the administration had created, to be able to actually get dollars into those local communities. And I think it's an interesting time because we're all dealing with something that was not anticipated in terms of how quickly this was going to spread literally around the world, and then the impacts that we saw in our country in particular, and then some of the variances in terms of the impacts given the size of our district in the state of Colorado. But I think that the efforts are being made to be able to make sure that we are doing what we can to be able to keep people safe and healthy, and those will continue, I think, as we move forward.
We'll now take a question from Chad in Delta.
Hello.
Hi, Chad. Thanks for being on.
Hi. Good. How are you? So
good.
My question is, I have an 8-year-old daughter that's, had many heart surgeries, over 8 heart surgeries already. She's supposed to have another surgery on. They said that it's not essential right now, and then that nobody would be able to be there, with her and everything. When you guys do the thing for the regional to try to open up more stuff, is it going to be also with the hospitals where more family members can actually, be there for the person that's in the hospital? Because my daughter goes at least once or twice a month to see her heart doctor in Junction. She goes down to Children's Hospital down in Denver a lot more. But lately, she cries because she can't have anybody there with her. And we're just trying to figure out, when more is going to be open for that, so I don't have to leave her there alone. And, she can't speak, really, so, and doesn't understand that's what's going on. So I didn't know, if that's going to open up more stuff with that, or if it will still be the same, or how that whole thing is going to play out.
Yeah. Chad, I'm really sorry that you and your family are going through that, your daughter. That's the most traumatic thing that you could probably think of. And a lot of the people that were being kept out of the hospitals were with COVID-19 infection, to be able to make sure that was not being spread. And that's where, as you noted, the surgery had been delayed because it was deemed as non-essential or elective surgery. But you amply demonstrate that this is very important, for the health of your daughter, and the importance of being able to do that. I'd probably defer to Jeff here in terms of the health department end of it, in terms of access in this type of situation for family members to be able to get in. Do you have some insight on that, Jeff?
I do, Congressman, and Chad, thanks for that question. I actually asked, so I have a daily call. It's not daily anymore, but the 3 CEOs of our hospitals, one of which is regional, and I talk regularly. And I did ask that question about a week and a half ago because it is a concern. And so it sounds to me like the hospitals have the ability to make that choice, and it sounded like they were very close. So what I'm going to do tomorrow is get back with them and see if we can have a regional discussion about allowing visitors into the various healthcare facilities, because I think regionally we're in a place where we can get that done. But that certainly isn't going to be me. That would be the hospitals having that discussion. But as I said, it felt to me like they were on the verge of pulling the trigger on that. So it's a great prompt for me to have this discussion again, and so hopefully we can get something done soon.
Thank you, Jeff. And we have time for a couple more questions. If anyone does not get a chance to have their question answered, we do ask that you give our office a call back, and we will give you the number here at the conclusion of this phone call. But for now, we're going to go with Cindy in Grand Junction.
Hi, can
Cindy.
you guys hear me okay? Hello,
we can.
My name is Cindy Ficklin. Hi, Grand Junction, Colorado. I'm actually Leadership Program of the Rockies, LPR Class of 2020. I'm sure you know what that means.
I do.
Yes, hello. Thank you for doing this. So I'm going to ask a hard question. With a 0.012 death rate in Colorado, or CDC published 0.2% death rate, which is still low even with inflated COVID deaths, why did you and others allow government to open Home Depot, but not a mom-pop shop local hardware store, or Walmart to shop for clothes, but not my friend's clothing boutique here in Mesa County? Who in government decided that kind of hypocrisy? What have you done to fight against it? How are you going to ensure that it doesn't happen again? And what are you going to do to ensure that our rights and freedoms guaranteed to us in the U.S. Constitution are not stolen from us again?
And thank you, Cindy, and appreciate your passion on this. The determinations in terms of what were essential businesses within our state were determined by the governor. That was not a mandate that came out of Washington. We did have, obviously, some continuity in terms of essential businesses, in terms of hospitals. As you note, Home Depot was not allowed to be opened. Every business I talk to views themselves as essential to be able to carry on business. We wrote a letter to Governor Polis to be able to give some variances to be able to make sure that those doors were open. But this was administered through the state level to be able to make those individual determinations. You point to some of the death rate and whatnot that we'd had. I think there was some of that we can probably attribute to some of the social distancing and hygiene practices that were in place given the unknowns of COVID-19. That we still, as a medical community, as society, don't fully understand all of the ramifications as we're hearing some conflicting reports going on. But we are now starting to be able to see those businesses open. I've always advocated, I'm a small business person for the majority of my life, and understand the importance of that for the people that I worked with and for what it contributed back to a community. And there was great frustration that we had in terms of those shutdowns. And I think that what we've advocated for with the governor's office during conference calls that we've been involved with is to be able to talk to the counties, to the local communities, to be able to look at the variances that we saw literally across our state and from community to community, in terms of the communicability of this disease that's going on. And you point to a very important point that, this our individual liberties to be able to carry on, and some social obligations to each other that people are practicing, and we're now seeing some of those businesses that weren't allowed to open successfully reopening, and at least the reports that we're having out of our communities, we aren't seeing a big spike going right now. And so these are some lessons that the state governor can learn and I think be able to reflect on.
Thank you, Congressman. And with that, our time has concluded, so we will go ahead and let Congressman Tipton give his closing remarks before concluding tonight's call.
Well, thank you, everybody, for taking the time to be able to be with us this evening. These are important issues that have impacted all of us. And I do want to particularly thank Jeff again for his availability to be on this call with us and to be able to answer some questions. Do want to let you know that our staff, myself, we are available on issues as they come up to encourage you to be able to reach out to our offices to where it's appropriate for us to be able to help you. And in addition to improving legislation and working with local leaders, my staff and I have helped nearly 350 constituents with federal agencies since March. And of those, we've helped numerous small business owners navigate the SBA loan applications, and nearly 100 constituents secure benefits through the IRS. And just during this COVID period of time over the last couple of months, around 90 veterans with ongoing issues with the Department of Veterans Affairs. And we're going to continue to make sure that we'll be available to help you or someone you know who may need some assistance with some of federal agencies, as we're seeing the ball start to move and some variances that are going to be granted to be helpful where we can. So please feel free to reach out to us. And if you can't do that, do feel free to go onto our website and visit tipton.house.gov for more information. And I am pleased how our communities have faced this period of adversity, and we'll continue to fight to make sure that our rural communities, our voices are heard. We've advocated this with the governor at the state level and certainly at the federal level as well. We are making progress and returning back to some semblance of normal life, but would ask that we all do continue to recognize this is a very communicable disease. We practice that social distancing, good hygiene practices, and to be able to work together to be able to make sure our families and our communities are going to be safe. And once again, Jeff Kuhr, I do want to thank you very much for your availability to be able to give us updates from Mesa County, which reflects a lot of what we'll hear throughout our 29 counties in the 3rd Congressional District. If you would like to be able to get in touch with our office at the conclusion of this call, please do dial 202-225-4761. Again, that's 202-225-4761. And appreciate all of you taking time for being on the call, and God bless you.
And before we hang up, Jeff, did you have any closing remarks that you'd like to share?
No, I just want to say thank you to Congressman Tipton and to you, Matt, for the opportunity. It's been great, and I really enjoyed hearing all the questions, and it's my mind is buzzing with a to-do list for tomorrow with all the topics that have come up. So thank you very much.
Perfect. Well, that concludes tonight's call, and again, thank you everybody for joining us, and please reach out to the Congressman's website or call any of our 5 offices, and we'll be happy to help. Have a good evening.